Welcome to the American College of Surgeons from the front lines for our bulletin brief. Today we're going to be chatting with Dr. Ann Sosa. Dr. Sosa is the chair of the Department of Surgery at the University of California, San Francisco, and also for the last several years, Dr. Sosa has been the editor-in-chief of the World Journal of Surgery. Welcome, Ann.
Thanks for having me.
Thanks again for taking the time to be with us. And we're going to speak today about your role as editor-in-chief of World Journal of Surgery rather than your role as the chair of surgery at UCSF. Specifically, as people may know, another journal, Surgery, for which I'm editor-in-chief along with Kevin Burns, hosted a webinar, and you're kind enough to spend some of your time on our editorial board, as are several other people who participated in what was a very informational webinar that thus far, between live viewers and archive viewers, has had thousands of visits to it. All of the lectures are superb. And I'd like to focus on yours, which was, what are the editors looking for in a review? But before we get to that specific question, perhaps you can talk about why it's important to participate in the peer review process.
All of us are guilty when we advise our junior faculty members and learners. We say no when they're getting started in their careers. And I think we say that to protect them from making too many commitments of service such that they cannot focus on the development of their passions and careers. I actually have started saying to some of our faculty, please say yes strategically to some opportunities. And one of the opportunities that I think it's important to say yes to is peer review service. And I say that because peer review, I think, is about being part of the larger surgical and scientific community. If you are a scientist and if you are an author and you expect your colleagues to evaluate your work to improve it and ultimately to determine whether it is appropriate for publication, then you must reciprocate as a member of the community and provide that same peer review. But it's not just about being a member of the community. It's also about improving the quality of your own science. So if you are reviewing colleague science for quality, for methodologic rigor, that empowers you as well. You learn about how to write, you learn about how to do study design, how to analyze rigorously, how to organize papers, the kind of language to use. And so I think it's sort of a symbiotic relationship where it's give and take. You provide a service, but you also gain from it. And so often say no, but when it comes to peer review, I would say yes. And I would say yes strategically. And I guess the last thing I would say is when I say strategically, I often say to people, choose a couple of journals where you're going to focus your energy and compile a body of peer reviews that ultimately will empower you to potentially become an editorial board member or even associate deputy or full editor-in-chief. I think doing one review for like 20 different journals won't allow you to build or compile that record that will allow you to be promoted to the next stage.
Thanks very much. And as mentioned, of course, it helps the individual surgeon improve his or her work going forward because of having participated in that critical process and subsequently, hopefully, looking at the reviews from the other reviewers to see what other points did people make that I didn't make. One of the caveats for saying yes, of course, is timeliness. And although journals may have different requirements, what do you tell your faculty and your trainees about the anticipated maximum amount of time, because of course saying yes and then producing no isn't terribly good either.
Never say yes if you cannot deliver, right? And I would rather have someone say no and have them say to me, I'm saying no because time commitment, because it's outside my area of expertise. These are valid reasons to actually say no. But if you're going to say yes, it's say yes and meet the deadline. So how much time should it be? I think it depends on the journal. Many journals say 30 days, some say 2 weeks. I think you got to look and see what that is, and then make sure your work and your planning meets the expectations. So read the directions very carefully. Most journals will send reminders, which you should heed. But usually it's between 2 and 4 weeks, rarely if ever beyond that. Although I will say with the pandemic, most editors in chiefs have been a little more forgiving because we understand sort of the urgency and emergency of what is going on in people's local lives.
Thanks very much. So now moving on to your lecture, which was what do we as editors-in-chief expect from our reviewers? Perhaps you could outline that for us, outline some of the outstanding points that you shared with our audience.
Yeah, so thanks for that. And you know, I think in life, being organized is pretty important. And I think the organization is not just around your schedule and making deadlines, but also around following a formula for how to deliver a really good review to your colleague who is an author. So I have this sort of top 10 list. As you know, I have top 10 lists around a lot of what I do. Sometimes I have a baker's dozen. But if I walk through sort of what I said in the presentation, I think the first thing you do is to provide a brief recap of the study. So demonstrate in just a couple of sentences to the author and to the editors that you actually read this study and you understood the study. I think that is reassuring to both parties that this is a qualified reviewer. I think secondly, you want to provide helpful feedback. You do not want to be cruel. You do not want to be dismissive or punitive. And there I say, imagine you are in the seat of that author. It's not just receiving the news, it's how the news are delivered. So I think you want to be useful and helpful. One sentence is, whether it's yes or no, is kind of disrespectful and kind of dismissive, especially if you're going to reject a paper. You want to provide feedback that allows the authors to improve the manuscript for wherever they resubmit it. Third is you want to ask yourself, is this the right journal or audience for this paper? The best paper in the world that is sent to the wrong journal will not be read. So if you have a basic science paper and it is submitted to a clinical journal, it may be methodologically rigorous and important, but the readership will not appreciate it. And so if it is the wrong audience, you can make the suggestion of an alternative venue. I think fourth is, did the authors follow the instructions? And you can't assume anything. Sometimes a paper is too long. Sometimes there are too many authors. Sometimes the references aren't formatted right. So you just want to go through the instructions. Often this is picked up already by the managing editor's office in the publisher's side, but still it's worthwhile thinking about as a peer reviewer. Next is the study new? If the study is methodologically rigorous, but the 20th study showing the same thing, reject it. It is not novel and it is not advancing the field. Is the research question important? Meaning, again, super rigorous question, but it's hypothesis generating. We don't really want hypothesis generating work in the vast majority of the peer-reviewed literature. We want something that is answering a hypothesis. So is the research question important? 7, was there IRB approval? And if it is not mentioned, you can ask about it, but that may be a death knell. You must have IRB approval for human subjects research. Then 8, really the focus, the meat of what the peer review are doing, and that is looking at methodologic rigor. Is there adequate sample size to power the analyses that were done? Did the analyses actually pertain to the research question that was asked? Were the right statistical tests deployed? Are more experiments needed to adequately assess the answer? So that's methodologic rigor, and I would say that's the largest portion of the review should be focused there. Then number 9, and for the editor-in-chief, this is the bottom line. How do we triage this paper? Should it be accepted or rejected? Or there are very few papers on first iteration that are ready to go. So is this a major revision? Is this a minor revision? Is this going to take multiple revisions, which some journals call reject and resubmit? But you got to give them sort of the fist to 5. What should we do with this paper? And that's usually just a bubble that needs to be filled out. And then finally, the confidential remarks to the editor-in-chief. And that's where, for instance, if you have concerns that this is a double publication, where you may not want to articulate that directly to the authors, but you want to, in a confidential way, share your concerns, but also it may be something very positive, like bottom line, this is the best thing and transformative to practice, say, in endocrine surgery. That's where you deliver it confidentially to the editor-in-chief. I always say, though, please be courteous, and whatever you say to the editor-in-chief, use a volume, tone, and language that you would be willing for colleagues to read as well.
Well, thank you. Those are excellent comments, and I would ask Percy, do you ever use some of the confidential comments, if appropriate, and with maintaining the anonymity, of course, of the reviewer, to share those comments with the authors?
Yes, an example I would give you, Dr. Wexner, and you may have seen this as well, is where a peer reviewer said, I think I saw this at a meeting last year. I don't have access to the program online, but it might be worth your while checking. A second comment is, I have reviewed this paper for another journal and concerns were raised around. So these, again, are things that can be helpful for the editor-in-chief to have a larger context.
Thank you. And in your talk, you did have an optional 11th or bonus 11th, I forget exactly how you phrased it, but you had number 11, which I thought was exceptionally timely and germane, given the dialogue that all of the journal editors are now having throughout the world.
Yes, thank you for that. And number 11, the bonus is try to perform your review through the lens of diversity, equity, inclusion, and social justice. And none of us actually probably would have called it out in an explicit way until 2020 with the Med Bikini controversy that affected or impacted vascular surgery, but which I think is much larger and crosses every discipline and every journal. And I think that's where you have to make sure you're looking at a study that follows the Surgical Journal Editors Group guidelines around sex inclusivity. For instance, if this is a mouse study and the only mice included were male mice, if the disease being studied is a disease that impacts women and men, this is not an adequate study. Now, that's an extreme example, but where you need to actually be thinking in an active and intentional way about the way the study was designed, the subjects that were included, and the conclusions that were reached. DEI is incredibly important, very timely, and bonus consideration 11.
Excellent. The other side, of course, of that topic is who is being selected to review the manuscript. And we've also gone through significant, very much needed awareness and transformation in that regard since the same article you mentioned. And I believe that was started by other editors-in-chief and former editors-in-chief, Melina Kibbe and Julie Freischlag, who really got all of us engaged. I think there were an initial group of 10 or 15 journal editors-in-chief, and now that group, as far as I know, is something like 200 or more who've signed on. And perhaps you could share with the people who maybe are not familiar with what our commitment is.
Yeah, thank you for that. And again, you know, from the perspective of the peer reviewer, they don't know who the other reviewers are. They can't manage these things. But I think in response to your question, the first thing is this is an absolutely essential point for all editors-in-chief, associate editors, deputy editors who are assigning reviewers to manuscripts to be thinking about who's on editorial boards, who's in editorial leadership, and who are the peer reviewers judging their colleagues and the quality of their work. The comments, you know, I made were from the perspective of the peer reviewer and the kind of considerations they have. But as journal editors, I think we are thinking about who is in leadership right now. Is this broadly representative of American and international surgery? If it isn't, how do we nominate people to editorial boards? How do we choose peer reviewers? How do we choose our legacy, who the next editor-in-chief will be? So these are all incredibly important, and it starts with who to nominate or choose for some of these positions. I think, though, that it goes even further. And one thing our journal has done, and this had been suggested by Drs. Freischlag and Kibbe as a consideration, is to have an ombuds, meaning someone whose job it is on an editorial board who is thinking 24/7 through this lens. We have such an ombuds person who we named last year, so this is a new addition to our editorial board. And I will tell you, it is probably the best thing we've done in that in the last 3 months, one manuscript came through that had been accepted and was being prepared for publication. But when she looked at the abstract and the title, she said the language used here is insensitive and not contemporary. And so what we did was we took this observation back to the authors and they recast the manuscript, and it is now an improved manuscript. So that would be an example of how an intervention has actually changed what we do.
Well, that's a fantastic example, and it shows how, as opposed to just having dialogue, we're having action, and very much needed, very important action. So thanks for taking that leadership role. I appreciate, again, your sharing your expertise. I'm sure that all the listeners and viewers found it quite invaluable, and will take it with them. Precious information. Thanks again.
Thank you.